Want to pass your NCLEX? Then let's get started. Here are 10 pharmacology NCLEX questions. A client with hypertension is prescribed lisinopril, an ACE inhibitor. The nurse instructs the client to monitor for which potential adverse effects of this medication: hyperkalemia, hypoglycemia, hypertension, tachycardia. Pause the video and choose your answer. The correct answer is A, hyperkalemia. ACE inhibitors like lisinopril can increase potassium levels in the blood as a side effect. Regular monitoring of potassium levels is essential during ACE inhibitor therapy to prevent complications. B is incorrect. ACE inhibitors do not affect blood glucose levels. C is incorrect. ACE inhibitors are used to treat hypertension. D is incorrect. ACE inhibitors typically do not cause tachycardia. A client with asthma is prescribed albuterol, a short-acting beta-2 agonist. The teacher teaches the client that albuterol primarily acts by reducing inflammation in the airways, dilating the bronchioles, blocking histamine receptors, inhibiting leukotriene production. Pause the video and select your answer. The correct answer is B, dilating the bronchioles. Albuterol, a short-acting beta-2 agonist, primarily acts by dilating the bronchioles, leading to bronchodilation and relief of airway constriction in conditions like asthma. A is incorrect. Reducing inflammation in the airways. Albuterol is a bronchodilator and does not have significant anti-inflammatory effects. C is incorrect. Albuterol does not block histamine receptors. D is incorrect. Leukotriene inhibitors are a separate class of medications. A client is prescribed warfarin for anticoagulation. The nurse instructs the client to maintain consistent intake of vitamin K containing foods to avoid fluctuations in the medication's effectiveness. Which food should the client be cautious with? Spinach, oranges, bananas, apples. Pause the video and select your answer. The correct answer is A, spinach. Spinach is high in vitamin K, and consistent intake of vitamin K containing foods is important for maintaining the effectiveness of warfarin. Fluctuations in vitamin K intake can affect the anticoagulant activity of warfarin. B is incorrect. Oranges are not high in vitamin K. C is incorrect. Bananas are not high in vitamin K. D is incorrect. Apples are not high in vitamin K. A client is prescribed acetaminophen for pain relief. The nurse educates the client to avoid excessive intake of alcohol while taking this medication due to the risk of liver damage, kidney damage, GI bleeding, hypertension. Pause the video and select your answer. The correct answer is A, liver damage. Excessive alcohol intake while using acetaminophen increases the risk of liver damage. Both alcohol and acetaminophen are metabolized by the liver, and their combination can overwhelm the liver's detoxifying capacity. B is incorrect. Acetaminophen is primarily metabolized in the liver, not the kidneys. C is incorrect. Acetaminophen is not associated with GI bleeding. D is incorrect. Acetaminophen is not known to cause hypertension. A client with type 2 diabetes is prescribed metformin. The nurse instructs the client to monitor for which potential side effects of this medication: hypoglycemia, hyperkalemia, lactic acidosis, hyperlipidemia. Pause the video and select your answer. The correct answer is C, lactic acidosis. Metformin is associated with the rare but serious side effect of lactic acidosis. Clients taking metformin should be educated about the signs and symptoms of lactic acidosis, such as weakness, malaise, and respiratory distress. A is incorrect. Metformin typically does not cause hypoglycemia on its own. B is incorrect. Metformin does not typically cause hyperkalemia. D is incorrect. Metformin may have beneficial effects on lipid profiles. A client is prescribed digoxin for heart failure. The nurse assesses the client for which potential signs of digoxin toxicity: bradycardia, hypertension, hyperkalemia, visual disturbances. Pause the video and select your answer. The correct answer is D, visual disturbances. Digoxin toxicity can manifest with visual disturbances such as blurred or yellow vision. Other signs of toxicity include nausea, vomiting, anorexia, and arrhythmias. A is incorrect. Bradycardia is a side effect but may not be an early sign of digoxin toxicity. B is incorrect. Digoxin is not associated with hypertension. C is incorrect. Hyperkalemia is not a typical sign of digoxin toxicity. A client is prescribed furosemide, a loop diuretic. The nurse monitors the client for which potential adverse effect of this medication: hyperglycemia, hypocalcemia, hypokalemia, hypernatremia. Pause the video and select your answer. The correct answer is C, hypokalemia. Loop diuretics like furosemide can lead to hypokalemia due to increased excretion of potassium in the urine. Monitoring potassium levels and providing potassium supplements may be necessary. A is incorrect. Loop diuretics are not associated with hyperglycemia. B is incorrect. Loop diuretics do not typically cause hypocalcemia. D is incorrect. Loop diuretics typically lead to sodium depletion, not hypernatremia. A client with rheumatoid arthritis is prescribed methotrexate. The nurse instructs the client to undergo regular laboratory monitoring for which potential adverse effect: thrombocytopenia, hypokalemia, hyperglycemia, hyponatremia. Pause the video and select your answer. The correct answer is A, thrombocytopenia. Methotrexate can cause bone marrow suppression, leading to thrombocytopenia. Regular monitoring of complete blood cell counts is essential to detect and manage potential hematologic complications. B is incorrect. Methotrexate is not typically associated with hypokalemia. C is incorrect. Methotrexate is not known to cause hyperglycemia. D is incorrect. Methotrexate does not typically cause hyponatremia. A client is prescribed atorvastatin for hyperlipidemia. The nurse advises the client to report which potential adverse effects of statin therapy: hyperkalemia, myopathy or muscle pain, respiratory depression, bradycardia. Pause the video and select your answer. The correct answer is B, myopathy or muscle pain. Statins, including atorvastatin, can cause myopathy or muscle pain. Severe cases may lead to rhabdomyolysis, a serious condition characterized by muscle breakdown. Clients should promptly report any muscle pain or weakness. A is incorrect. Statins are not associated with hyperkalemia. C is incorrect. Statins do not cause respiratory depression. D is incorrect. Bradycardia is not a typical side effect of statins. A client with depression is prescribed fluoxetine, a selective serotonin reuptake inhibitor. The nurse educates the client to avoid combining fluoxetine with which over the counter medication due to the risk of serotonin syndrome: acetaminophen, ibuprofen, diphenhydramine, aspirin. Pause the video and select your answer. The correct answer is diphenhydramine. Combining fluoxetine with medications like diphenhydramine, which also increases serotonin levels, can lead to serotonin syndrome. Serotonin syndrome is a potentially life threatening condition characterized by agitation, hyperthermia, increased reflexes, and rapid heart rate. A is incorrect. Acetaminophen does not typically interact with fluoxetine in a way that causes serotonin syndrome. B is incorrect. Ibuprofen is not associated with serotonin syndrome. D is incorrect. Aspirin does not typically interact with fluoxetine to cause serotonin syndrome. Click that subscribe button and join us next Wednesday. Comment below and let us know what is one new thing you learned.